What future follow-up do you recommend if there's no actual cardiac involvement?
What sort of follow-up?
If there's actually no cardiac involvement, what sort of future follow-up do you recommend for parents?
So most sort of the guidelines would state that if you've had no cardiac involvement or if you had just some transient dilatation that resolved very quickly, that you're probably at no risk for any late cardiovascular sequelae. So I tend to discharge those patients and not see them, but before I do that, we talk about Kawasaki disease, and I make sure that we talk about healthy lifestyle, and that if you have Kawasaki disease, it makes it extra, I use it as an opportunity, is part of your medical history now. So if anyone asks if you have any illnesses as a child, you say, yes, I had Kawasaki disease, but I had no heart complications, and I'm fine.
So we have a situation of in Australia, doctors are telling parents to forget that the child ever had it, and not to even mention it in the future.
Yeah,
so it's sort of
we don't know what the long-term consequences are. I think it's good for families to just keep that in the back of their mind and not forget that it's part of their medical history. Not to worry about it, but if you never know when new information is going to come up. You don't want to forget that part of your history.
I'm a cardiologist in Hamilton, it's a smaller city in Canada. I usually write a letter to the family doctor recommending that at least according to the HA guidelines, usually for 3 to 5 years, every 3 to 5 years they should follow up with the family doctor and review lifestyle issues and any questions that may come up. And family doctor has questions, they are free to call us and request a reassessment, whatever they find necessary.
As a follow-up to that question, are the AHA guidelines broadly followed across all countries, or is it different if you're in India versus Mexico or any other country?
So in general, the guidelines from the AHA are followed in North America and in other countries that don't have their own guidelines. In the Asian countries, Taiwan, you have their own guidelines, and in Japan, they definitely have their own guidelines. They tend to all more or less agree. There may be subtle differences between them.
I'm Mei-Hwan Wu from Taiwan. Because the incidence rate of Kawasaki disease in Taiwan is the 3rd highest in the world. I think as the ethnic aspect is a picture between Asia and it's a kind of, I think we are similar to Japanese and Korea in ethnic consideration. So our guideline is a little bit mixture of AHA and Japanese one. But for those without cardiac complications, we will see them probably every 5 years just to see any new progress. And also, we can advise parents give the anxiety and uncertainty to doctors.
See, basically in Australia, I think there are no guidelines, and that's the problem we have. Parents are just being told to forget about it as if it never happened.
You should use the AHA guidelines in the absence of any others.
日本の親の会の浅井でございます。日本語でお願いします。日本のガイドラインの件ですけども、後遺症が急性期になかった場合は、日本のガイドライン、要するに日本小児中間期学会のガイドラインは、5年を最低、5年間は最低見なさいと。5年を過ぎれば、保護者の方と話してやめてもいいよというのがガイドラインです。ただ、日本の医療事情の中で川崎病を非常に熱心にやっている先生ほど5年では終えてないです。これはあくまでガイドラインですから、過ぎても構わないんですけど、 一生懸命心臓をやってる先生ほど、中学生ぐらい5年というレースで切るんじゃなくてやってます。そして日本では実は、それでこれ切るときによく、これで切っていいよという先生がいらっしゃる。その時に一番大変なのは、やっぱり川崎にかかったということを日本語で風化させないって言うんですよ。風化させないために、川崎病の急性期カードというのができておりまして、川崎病の急性期にどんな治療をして、どんな症状があって、ガンマグロビンをやったのかやらないのかという状態を全部書いて、で、関東膜障害があったのか、プラスなのか、マイナスなのか、どの程度なのかと書いて、要は本当のカードです。はがきぐらいのカードですけど、それをみんなに持たせてます。ですから、体の方、ドクターは忘れろということですけど、逆に日本のドクターは覚えておけよという活動をしておりますので、一応コメントとしてごやらせてもらいました。
I agree with you completely. I have a constant fight with my nurses because I wish I could follow all the patients we see with Kawasaki, like every 2 years, every 3 years, in the cardiology clinic, and do echoes and exercise tests and whatnot. But the issue in Canada is that we're limited. We have way too many patients, and for those who are healthier, or there's no coronary aneurysms, but they have Kawasaki. For those patients, there's no left spots to be followed, so that's a big constraint I think
I can tell you from all of the research evidence that children who had no coronary involvement during the acute phase do as many tests as you want for as long as you want.
Yeah, I do agree with the proposal from the AHA regarding the long-term follow-up for those without cardiac complication. But to discharge a patient in Asian countries means a lot. Means that probably the patient might get a feeling that the doctor don't want me anymore. So I think it's a kind of, in Asian countries, sometimes the relationship between doctor and patient is like a parent and children. So in Asian countries, sometimes we tend to follow them, but in longer intervals, such as 5 or even 10 years, invite them to come back to see if anything else that we can do with medical progress. So every 5 years is very reasonable for Asian people.
I was just wondering, how often should a child with multiple aneurysms have an angiogram done, considering how much ventilation is in that type of test?
There are a lot more different kinds of tests that we now can use to monitor the coronary arteries that don't involve either no radiation or as much radiation. So I think that the tendency is to move more towards using things like MRI or CT scans, doing stress echoes, and reserving the angiograms for sometimes to do a baseline assessment, but also if there are any worrisome things on any of those tests or the patient is having symptoms, then you go on to do the angiogram. Certainly at Sick Kids, for a while, we routinely did angiograms on our aneurysm patients. And but we developed a very good protocol with the MRI that actually tells us about the coronary arteries. It tells us about how well the blood is getting through the aneurysms to the heart muscle, whether there's any scar going on in the muscle, how well the heart is contracting. That we started relying more on MRI and doing a lot fewer angiograms.
So I feel like my question is going to be a little bit more broad and may require more than one person to answer. But as a patient, I feel like I know what to kind of expect, think how Katie has affected me. And I know every single person in this room right now, parent or patient, has all been told something, at least once in their lives, on what to expect. But having the humbling experience to be able to sit down in the rest of the symposium and listen to all of the cutting edge research everyone has been pouring their hearts into and trying to do to fix this and figure this out, what would you kind of say for someone newly going into Kawasaki or someone who's already lived it for so many years on what we should maybe kind of expect in the future, or to just to help put some people who may not be at ease to just get them to understand a little bit better? I know, I apologize for the question. That's too broad.
So my approach has always been to take things as they come. So you sort of prepare for the worst, you hope for the best, but what you're really dealing with the patients is you're dealing with what's happening right now. I think that my approach is to try to get people to focus on what's happening right now. We're prepared should anything adversely happen. We're monitoring you closely, but to live your life in the moment.
I'm Dr. Shulman from Chicago. I think that it's really important for Kawasaki patients and parents to understand that 98 or 99% of the patients are going to do exceptionally well, just exceptionally well. Move on with your life, do your thing. And for those 1 or 2% of the patients who have problems, they need very individual advice because everybody's circumstance is different and unique. And an exceptionally small number of people worldwide are going to need interventions and all kinds of issues going forward. But that's really the rare person. Other individuals who just need follow-up once a year, once every 2 years, and everything in between. So, but it's important to keep the big picture in mind, to keep perspective on things. And as we've heard from Adrienne, we don't want to control our life. You want to control your life.
Add something, there's a non-position. So I work with young people and also middle-aged people, and sometimes they'll talk to me older ones, so actually even early mid-20s, late 20s, early 30s, and oftentimes they'll look back often and they'll say, you know, I wish I had known I was going to be around now and I was feeling this way. Because when I was younger, I assumed that my illness would define me, and so I actually didn't really focus so much on school. I didn't focus so much on figuring out what I wanted to do with my life. And I'm in my 20s, and I think, shoot, I should have studied harder, or I should have done things differently. I often hear people talk about regrets in terms of not having taken advantage of any opportunities, not having a plan for the future. I've actually never met anybody who has said, you know, wish I hadn't gone to school, wish I hadn't got a job. So I would assume and expect to live as rich a life as possible, take advantage of these opportunities. I've never met anybody who's regretted doing
I think you should say that, because I was just sitting there saying, will I get up and ask this question? And if I don't ask the question, then I'll regret it. I'll go home to Australia and I will regret it. My son has a left ventricular aneurysm, so his arteries are fine, but the aneurysm in his ventricle is 2 centimetres big with quite extensive scarring across the heart wall. My question is, have any of your come across such aneurysms because I had no information in Australia at all. I've seen doctors in Australia who said they've heard of it in Japan, but had never seen it themselves.
So to explain to everybody what a ventricular aneurysm is it's usually an area that was damaged due to lack of blood flow, probably related to aneurysms in the coronary arteries. And what happens is that area becomes an area of scar tissue that sometimes can weaken over time, and just like a weak spot in the arteries, a weak spot in the wall of the heart can develop as well. And so that pouches out and it doesn't squeeze. The blood can sometimes pool in that area. Sometimes it's a risk for clot. Sometimes it causes the function of the ventricle to be a bit uncoordinated. But for young people with ventricular aneurysms, they tend to stabilize, but at least the patients that I've had. And they may have some minimal decreases in their overall function, but they tend to stay stable for a long period of time. But that is a very rare complication. Anyone?
How old is your son?
He's 20 now. He was 2 when he had Kawasaki.
Because just as Brian said that the relative proportion of aneurysms might decrease with age. So if you compare the relative size of the aneurysm at the age of probably early childhood and young adulthood, probably you'll find numbers decrease with age. That would be a good sign. Yeah, but don't forget anti-platelets.
I have a question for, I asked for one of my patients. She's a young lady, 22 years old. She had Kawasaki disease at 2 years old. And fortunately, her cardiac issue is very mild and recovered very soon. Right now, the problem is when she applied a job on flight, she was rejected because of history of Kawasaki disease, although she doesn't have any cardiac symptoms. I want to ask anybody in the room has a similar experience or how to handle this problem.
You know, it's difficult to deal with ignorance, and that's a demonstration of ignorance. In the U.S., we've had patients with rheumatic fever and no heart involvement, or Kawasaki, no heart involvement, used to be denied health insurance on that basis. Now we have a law that you really can't deny health insurance on the basis of a pre-existing condition, unless the Supreme Court messes that up. So hopefully that's a very difficult issue. Is the answer.
I'm Annette Baker from Boston, I'm a nurse practitioner, and I constantly get health forms and questions and people trying to go into the Army and military and school sports. And I do think it's very important to make sure your healthcare practitioner knows what your medical history is. But if you never had coronary aneurysms, you've always had normal coronaries, you have heard from your physician that you have no limitations and no medications, I'm not sure how much as you go up you need to put on every single form that doesn't affect your health care in general. So if you have full range from your physician to play full sports, it becomes difficult because every time it raises a red flag, and then you have to go through this whole series of events with people who don't really understand the illness. So you have to weigh the risks and benefits of telling every single person. But I think your healthcare provider needs to know. You need to know.
okay if I ask a different question? Okay. I was wondering if you guys have a website that we can go to for professionals that are experienced in Kawasaki, cardiologists and stuff. Because they failed diagnosis and so my trust is lower. But if there's somebody that's already experienced in it, I'd like to contact them. It's in Utah. Is there a site to go to or someone that I can find?
So I will say that in the U.S. we often field questions for references, and we try to match up inquiries with doctors who are known locally, and if not, we do have a trusted panel of advisors and doctors who are often willing to field calls and then perhaps consult with local medical professionals, and if our panel can speak on that and how the receptiveness to those types of inquiries are handled.
Do you still have on your website, Greg, the Kawasaki Foundation, a link that helps people contact?
We do. We used to publish a list, but the inquiries have become much more broad, so now we field them on a case-by-case basis, and so often it's just making contact with one of the doctors that we know who are happy to take questions.
When it occurred, it's kind of like who was accepting patients at that time. I don't know anything about them. Do they have the experience? I don't want to get left behind again. I feel like that's what happened. So I want to be more engaged and find someone that knows what they're doing, can set up a care plan. He has coronary aneurysms, full science. And so I'm looking today to find someone that can be knowledgeable and take us through our care. And we may have somebody, I just don't know.
It sounds like something we should talk about offline.
Oh, okay. So no, you don't have it on a
We don't have a listing, I would say, of recommended Katie doctors on the website because the list would have to be specific to locale, and so what I would suggest is afterwards we can start with Dan and then find out who we might know in the Utah area that may be kind of a go-to person for you.
Thank you.
Can I just add something? So I think it's great that you're trying to find somebody as well. And I would think of the first appointment as an interview where you actually get to ask them the questions. So I would write down some specific questions ahead of time. I would first of all go in and explain that you had some maybe negative healthcare relationships before or healthcare experiences. So you give them the opportunity to maybe be a little more patient and spend more time with you. So definitely share those experiences with them. And you can do an interview. So I would ask them, how many patients with Kawasaki disease do you have in your practice? I don't know what a good number is, but I would make sure that your child is not the only one. If you have questions, who do you turn to? So I would come up with the things that in your mind would help you feel more confident with them, write them down and ask those questions.
My name is Crystal. My son actually got diagnosed a month ago. My question for you, I feel like it was such a blur. It happened during the holidays. There's so many things going on. In your experience, what's the recurrence rate? Because my son actually got 1 dose of IVIG. He got Remicade, which is the new technology now, or the new research. And he actually had to be readmitted to the hospital because he got a 3rd dose of Remicade, or a 2nd dose of Remicade, a 3rd dose of treatment. It's just so emotional, because I had no idea what Kawasaki disease was. He's 2, and I just want to know your opinion of the recurrence rate. He has no cardiac, they caught it on the 5th day, he has no cardiac involvement, thankfully, but I just don't know anything,
So I can tell you're caught in the roller coaster that people feel during the first few months when they're trying to deal with this, and when you're still trying to deal with a lot of the acute issues and things are, as we say, hot right now. But the recurrence rate is actually quite low for people to have a second episode. But if they are going to have a second episode, it's going to happen sooner rather than later.
Which is what happened with him.
Yeah. So but it sounds like whoever's providing your healthcare is on top of it and giving you the state-of-the-art therapies.
I think it's because we live here in Hawaii, and there's so many Asians that live here, so thankfully they caught it really early.
There's greater awareness of Kawasaki disease in Hawaii, I think, than really anywhere. But
versus being on the mainland, right? But I know that the doctors in the hospital were saying when baby got readmitted the second time that it was such a small percentage for him to have a relapse. So I was just wondering what we could possibly expect,
Well, I think I've...
Like years, like...
People, when they're caught in the roller coaster, they think about what's happening right now, but they start thinking about what's going to happen in the future, and it's a huge, vast unknown to them. And I think that's when people feel the issue of the uncertainty the most. Because early on in the disease course, it's much harder to make predictions. When things start settling down and you see what you're actually, predictions for the future get to be a little bit more easier to make. But when you're trying to deal with a disease where people don't even know the cause of it, you're talking to doctors who've never heard of it before, you're talking to your family, they've never heard of it before, things are going well and then suddenly they're not going well again. It can be a real challenge for you.
Crystal, think about what Adrienne said. Always concentrate or try to concentrate on the positives. He was got early, and as you said, he doesn't have anything wrong with the child, right? Yeah. No aneurysm. So that's a huge positive. And just concentrate on that and wait for the next partner and go from there. As you said, wait and just think about the good things now, and then that will take you through this roller coaster.
Thank you.
If I can just add one more thing. So it sounds like your child's getting good care. My guess is your doctor takes care of other people with Kawasaki disease?
The hospital.
The hospital doctor. So
a family practitioner.
So sometimes providers, doctors and nurses will know of other families who have recently gone through it. So sometimes it can be helpful to ask them, is there anybody you know of who would be willing to chat with me about it? So sometimes I think getting that parent-to-parent contact can be very helpful too. I don't know, do you ever have queries or?
No, I do, but I think
Not
it's
yet.
a very good idea because sometimes listening to other people's stories can really help you cope with your own situation. And there are a number of people parents that have started blogs, and that's one of the ways they cope with things is they start sharing their story, and other people start sharing their stories with them.
I will add to that there are a number of KD-specific support organizations. Kawasaki Disease Foundation in the U.S. is one example where we have support volunteers who are always happy to take calls and inquiries. And if you're not in the U.S., there's Australia and Canada. So there are people who have been through this before and can provide their perspectives and advice along the way. And one thing I will say, in the 15 years or so that KDF has been around, we do hear about recurrent cases, but they're very rare. And what we've learned in those cases is that the parents are generally the ones who will diagnose their kids the second time around because they know so much about KD and what to look for. So they're the first line of defense in treating their kids.
And to put that into some numbers, in the general population, non-Asian populations, a second attack of Kawasaki months or a year or two after the first attack only occurs in less than 1 out of 100 children. In Asian populations, it's more like 3, 4.
Less than 3%.
So there are some individuals, some patients who will have you described more of a relapse, that the first episode didn't exactly get totally controlled and it smoldered along for a few weeks now. A recurrence usually refers to something after a child's been perfectly healthy, resumed perfectly good health, and then has a whole new episode of Kawasaki. That's much more uncommon, and it's at 1% to 3% sort of range.
I think we're running out of time, but the panel's been very generous. I just have one wrap-up question. I don't want to steal your thunder for tomorrow because you're going to do a recap for the doctors, but for the parents, there was a lot of science discussed the past few weeks, and I think we're all wondering what the future of science is for KD, and what are the things that you're focusing on that are promising in terms of the cause, therapies, treatments that you can summarize for us.
Yeah, so in like 10 sentences. 3 days and 10 sentences. So the cause, when we actually interviewed Dr. Kawasaki and asked him what the #1 priority was for him, and he said, we really need to find out what the cause of Kawasaki disease is. Because until we find out what the cause is, we don't have specific ways to diagnose it, we don't have specific therapies for this particular condition, and we don't have a way that we can actually prevent it. So a lot of the discussion in the meeting was around new things about potentially associations with environmental factors, with genetic factors, with
infectious, possibly infectious. We believe it's an infectious agent, virus, but it's not proven yet.
So and a lot of the things that then fall out of that are new thoughts about the diagnosis, new thoughts about genetic factors, different pathways that we can target for new therapies. But then today was all about a lot of the cardiology. So new ways to look at the coronary arteries and other arteries that function, and also the impact of different ways for aneurysm patients for anticoagulation, thinking about ways to reduce some of the scarring in the arteries. And then we have our session on psychosocial aspects, which are very important to people that provide care to you.
Very promising.